Hi all, in this video we shall discuss about a wonderful medicinal plant, the insulin plant identified as Costus pictus. This herb is native to Southeast Asia and it shares many similarities with another herb Costus igneus, a native of South and Central America. However, both these herbs are commonly known by the nickname insulin plant owing to their anti-diabetic properties. Though they are named as insulin plant, it is not to be considered as a substitute for insulin or any anti-diabetic medication that you are already on. This video is only for informational and educational purposes and it's not to be considered as a medical advice. The practice of using the insulin plant to control blood sugar levels is age-old and documented. Recent researches suggest that it has a very good effect to decrease the fasting blood sugar levels. Both insulin-dependent and type 2 diabetics have shown very good reduction in their blood sugar levels within 15 days of consuming the leaves of this plant. This study also mentions that the dose of insulin was reduced by half in those who were taking insulin. Alpha and beta aminos present in the leaves are said to exert potential anti-diabetic and anti-cholesterolemic activity. The phenolic compounds and flavonoids are also said to help in regulating the cholesterol levels. Preliminary research on experimental hypothyroidism induced in animals showed that Costus pictus had a good therapeutic potential to significantly improve the thyroid hormone levels. The same study and many other studies have also shown that Costus pictus has excellent antioxidant and anti-inflammatory effects. There have also been other researches which shows the antimicrobial diuretic effects of Costus pictus. Preliminary researches have also shown some promising anti-cancer potential of this herb, but the data is insufficient and requires more clinical researches on large populations to justify this effect. Now, let us see how to use Costus pictus. The leaves of Costus pictus have a mild sour taste and is pleasant to be consumed. Usually, one leaf is consumed afresh once or twice a day in empty stomach, or 1 teaspoon of the dried powder of the leaf is consumed with warm water in the same pattern. Although the available researches suggest that the herb has shown to be least toxic and safe to consume, a few researchers have raised concerns on the presence of hexadecanoic acid, also called as palmitic acid, in the leaves, which is around 24.5%. Palmitic acid is a saturated fatty acid which is found in animals, plants and microbes and is considered to be the precursor for the development of coronary artery disease. Palmitic acid has enough data which says regular consumption of foods rich in saturated fatty acids leads to increased LDL cholesterol levels. So, if you are suffering from hypercholesterolemia, this may not be suitable to be taken on a long run. Well, the other studies I have referred in this video also shows that it had helped reduce cholesterol levels in patients, which contradicts the effect of palmitic acid present in the insulin plant. However, it is always advised to discuss with your physician and take his advice before trying this herb for diabetes. What are your thoughts on this? Share your thoughts in the comment section. This is Dr. Harvey K. Rajaraman, a researcher in Ayurveda herbs. See you in the next video.